In our previous video, we posed a tricky question. What does brisk daily walking do for the heart? And the correct answer is regular activity like brisk walking raises HDL, lowers LDL, reduces blood pressure, and improves circulation, one of the most effective non-drug therapies for heart health. Did you know that over 1/3 of adults in the US are in the pre-diabetes stage, yet most of them don't even know it? Today, we're going on a journey through 35 fascinating questions about diabetes. Are you ready? Let's begin. What is the most common symptom of type 2 diabetes? When blood sugar levels are too high, the kidneys try to flush out the excess through urine. This leads to excessive thirst and frequent urination, especially at night, a classic early warning sign. How can type 2 diabetes be prevented? According to the CDC, a healthy lifestyle can reduce diabetes risk by up to 58% in high-risk individuals. Simple habits like cutting sugar, eating vegetables, and walking daily can save your life. How does physical activity benefit people with type 2 diabetes? Can you guess it? Leave your answer in the comments, we'll reveal it in the next video. Which of the following foods has a low glycemic index, GI, and is good for diabetics? Whole oats have a low GI, meaning they digest slowly and raise blood sugar more gradually. Low GI foods help stabilize blood sugar levels and reduce complication risks. What is the role of insulin in the human body? Insulin acts like a key, allowing glucose to enter cells from the bloodstream and be used for energy. Lack of insulin or insulin resistance causes glucose to build up in the blood, leading to diabetes. What are the benefits of eating plenty of fiber, from vegetables, fruits, whole grains, for diabetics? Fiber helps slow down the digestion and absorption of carbohydrates, which in turn helps blood sugar rise slowly and more steadily after meals, greatly benefiting blood sugar control. Which type of fat should diabetics prioritize in their diet? Unsaturated fats from salmon, olive oil, and avocados help lower LDL, bad cholesterol, and support blood sugar control. Trans fats, in contrast, increase heart disease risk in diabetics. How often should diabetes patients check their HbA1c levels? HbA1c shows your average blood sugar over the past 2-3 months. Checking it quarterly helps doctors adjust treatment and catch early complications. Which test reflects the average blood glucose over the past 2-3 months? HbA1c measures the percentage of hemoglobin coated with sugar, representing average blood sugar over 8-12 weeks. It's a key marker for diabetes management. What fasting blood sugar range is considered pre-diabetes? Prediabetes is when blood sugar is slightly elevated but not high enough for a diabetes diagnosis. It's a crucial stage where lifestyle changes can prevent full-blown diabetes. What can help prevent type 2 diabetes? Losing 5-7% of body weight, about 11 to 15 pounds for a 220-pound person, can cut diabetes risk by 60% in high-risk individuals. It's a proven and effective prevention strategy. What should diabetic patients do daily to care for their feet? Diabetes reduces foot sensitivity, so small injuries can become serious infections unnoticed. Daily foot care helps prevent amputations and complications. Which psychological factor can raise blood sugar in diabetics? Stress increases cortisol, which raises blood sugar levels. Diabetics should practice stress management techniques like meditation, deep breathing, and light activity to help stabilize glucose. Why is home blood sugar monitoring important for diabetics? Home blood sugar monitoring provides patients and doctors with a comprehensive view of how blood sugar levels change with meals, physical activity, and medication. This allows for timely adjustments to diet, exercise, and medication dosages to achieve target blood sugar levels and prevent complications. Why should diabetics limit consumption of sugary sodas and packaged fruit juices? Sugary sodas and packaged fruit juices often contain very high amounts of added sugar, which can cause blood sugar to spike rapidly, making blood sugar control difficult for diabetics. Which of the following is a nerve-related complication of diabetes? High blood sugar damages peripheral nerves, especially in the feet and hands. This causes numbness, burning, or sharp pain, and may lead to ulcers and loss of sensation. What serious complications are common in long-term diabetes patients? Chronically, high blood sugar damages small blood vessels in the kidneys, eyes, and nerves. According to WHO, diabetes is the leading cause of adult blindness and end-stage kidney disease. What does insulin resistance mean? Insulin resistance is a condition where the body cells, muscle, fat, liver, do not respond well to insulin, making it difficult for glucose to enter the cells and leading to glucose buildup in the bloodstream, causing high blood sugar. This is a primary cause of type 2 diabetes. What can happen if a diabetic sleeps less than 6 hours per night? Sleep deprivation disrupts metabolism, increases cravings, and worsens insulin resistance. Studies show that diabetics sleeping less than 6 hours face a 30–50% higher risk of complications. Which medication is most commonly prescribed first for newly diagnosed type 2 diabetes? Metformin reduces liver glucose production and improves insulin sensitivity. It's the first-line treatment due to its effectiveness, low risk of hypoglycemia, and affordability. Which type of diabetes usually begins in childhood and is caused by the immune system attacking pancreatic cells? Type 1 diabetes occurs when the immune system destroys beta cells in the pancreas, which make insulin. It usually begins in children or teens and requires lifelong insulin therapy. Which of the following are symptoms of hypoglycemia, low blood sugar? Hypoglycemia often affects patients on insulin or strong medications. Warning signs include shaking, sweating, fast heartbeat, blurred vision, and confusion. It requires immediate treatment with 15 g of glucose. Which sign may indicate a dangerous acute diabetes complication? Fruity breath is a sign of diabetic ketoacidosis, DKA, a dangerous condition usually in type 1 diabetes. It requires emergency medical care. When does gestational diabetes usually occur during pregnancy? Gestational diabetes is usually diagnosed between weeks 24-28 due to pregnancy hormones that reduce insulin sensitivity. If uncontrolled, it may cause large birth weight, complications, and future diabetes risk. Why do diabetics need to be careful with minor skin wounds? High blood sugar weakens the immune system and damages blood vessels, making wounds in diabetics more prone to infection and slower to heal. This is especially dangerous in the feet, which can lead to ulcers and amputation. Which of the following is the main cause of type 1 diabetes? Type 1 diabetes is an autoimmune disease where the body's immune system attacks and destroys the insulin-producing cells in the pancreas. This is not caused by lifestyle or diet. Why is blood pressure control important for diabetics? Both hypertension and diabetes damage blood vessels. When these two conditions coexist, the risk of serious complications such as heart disease, stroke, kidney failure, and eye problems significantly increases. Which BMI, body mass index, is considered high risk for type 2 diabetes? A BMI over 25, for Asians, the threshold may be lower, around over 23, is generally considered an indicator of overweight or obesity, a strong risk factor for the development of type 2 diabetes. What is the role of the hormone glucagon in blood sugar regulation? Glucagon is a hormone produced by the pancreas, which has an opposite role to insulin. When blood sugar is too low, glucagon signals the liver to release stored glucose, helping to raise blood sugar back to normal levels. What oral health problems can uncontrolled diabetes cause? Long-term high blood sugar increases the risk of infections and inflammation, including in the gums and jawbone. Diabetics are more prone to cavities, gum inflammation, and severe periodontal disease. How does sleep apnea affect cardiovascular health? Sleep apnea causes repeated episodes of oxygen deprivation at night, increasing stress on the heart and blood vessels, leading to a higher risk of high blood pressure, arrhythmias, heart attack, and stroke. Which test is commonly used to diagnose gestational diabetes? The oral glucose tolerance test is the standard test for diagnosing gestational diabetes, typically performed between weeks 24 to 28 of pregnancy. Why is insulin injection necessary for people with type 1 diabetes? People with type 1 diabetes have an immune system that attacks and destroys insulin-producing cells in the pancreas, preventing the body from producing insulin. Therefore, they need external insulin injections to maintain stable blood sugar levels. What is the connection between diabetes and Alzheimer's disease? Studies have shown that people with type 2 diabetes have a higher risk of developing Alzheimer's disease. sometimes referred to as type 3 diabetes of the brain due to the effects of high blood sugar and insulin resistance on the brain. What is an echocardiogram used for? An echocardiogram uses sound waves to create detailed images of the heart's structure and function, including chamber size, valve function, and the heart's pumping ability. Congratulations, you've completed the quiz. Here are your results. What's your level? Drop it in the comments below. Whatever it is, it's a beginning, and your body is thanking you for it. Share this video with someone you love, because someone close to you might be in the pre-diabetes stage and not even know it.